Hello, my name is Sara, creator and provider of the HAT training. Basically, HAT stands for Holistic Assessment and Therapies model, which claims to be very holistic and very systematic in the way that we see sexual dysfunctions or sexual abilities, disabilities, as well as going ahead and systematically approaching it in a way that we address, we assess, we diagnose, and we manage and treat these issues with individuals and couples. The reason that I came up with this course was that when I moved to the United States from Europe, more specifically from England, I realized that there is not much of systematic training for my colleagues in this area. So basically what the assumption is that you deal with the relationship issues or all the anxiety issues, other issues, and then all of a sudden, for some magical reason, the sexual problem is resolved. Sometimes through the lens of psychosexual therapy, we realize that it's not the case that you're failing in your communication skills or in your other skills in life in general, that your sexuality suffers. It's actually the issue of pain, as simple as that. Or when you're, for example, experiencing erectile difficulties, it's only because of that, not any other issues around it. So based on that, this holistic assessment and therapies model was born, basically. One of the things that I would like to achieve through this training, and I would like to think that this is the strongest differentiating factor between this training and other trainings, is that the holistic part of it. The other aspect of it is that it's very systematic. So once you're done with the foundation level and then you move on to intermediate and advanced, by the time that you're done with the advanced, you're pretty confident and competent in dealing with any sort of sexual issues that your clients present with, being individual or within a couple setting. The answer is my recommendation, regardless of your background and training. If you were trained within the United States or North America, I highly recommend that you start with the foundation, because regardless of bits and pieces of information that you might have collected about psychosexual issues, I guarantee that 70% of the course at least will be new to you. Another question was about the tutors of the course. As an ASECT accredited course, I have to teach. I'm responsible for the teaching of 80% of the course, of the whole content, but for another 20% of it, colleagues who know me and the standards that I live by and work with know that all the world-renowned experts in any specific area, for example, pain management, for example, out-of-control sexual behavior, all of those areas will come together to provide those certain trainings in those aspects that I don't claim to be an expert of. Any training usually covers three aspects, three pillars of it: knowledge, skills, and attitude training. Knowledge I'm not very worried about, because at least even if you go to a course or a training that the approach is not very psychosexually focused and they're not very informed about that area, but at least you can come out of the classroom and read on your own. There are quite a dozen good books and journal articles that you can read and educate yourself in, and lots of good workshops that you can attend. So knowledge is not a part of my worry for our global community when it comes to addressing sexual issues. However, for the skills part of it, I have a little bit of a more worry. Why? Because I will show you through the training as how you can ask the same questions but get very different answers, which are quite critical in the process of getting the information you need in the therapy session, just by tilting your approach a little bit, just a little bit of skills training there. So there's a lot of experiential work that goes into our work, role modeling and peer modeling, these sort of things, and a lot of case analysis within HAT training. The other aspect of it that I believe, in my humble opinion, that is missing from most of the trainings is the attitude training. So we are left to our own devices to make sense of everything, and we are left very vulnerable when we are dealing with our clients' sexual issues. And I think that's actually quite important. Within the HAT training, you are going to address a lot of your biases, your prejudices, not in a heads-on way of thing, but I'm going to subtly put it within the training in a way that after you're done with the training, your perspective towards many areas change. And I really truly believe, based on the 15 years of experience within this field, that it will make a huge difference in your approach and the success of the outcome of your work. The main 4 aspects that we are addressing within HAT. One is the assessment, addressing, talking about it, getting the information out from the clients so that we have enough data to put together to make sense of the situation. The second aspect of it is the diagnosis. What is this in our hand? How do we make sense of all of this data? And then with the treatment and management, I differentiate between those two in our training because treatment is when it's usually clear-cut. You have a problem and then you have a solution, you offer them through homework, through education, through different methods that we use within the psychosexual therapy. You address it, you solve it, move on. With the management, which is the case for many of our clients, is that they just need to learn to live with it. And we are going to help them, give them the tools to make it as pleasant as possible with themselves. Make the condition as pleasant as possible for themselves and their partner or partners, and then move ahead with their life for it not to be a sore aspect of their life anymore. So that's another difference that I don't hear in any other trainings, at least the ones that I'm familiar with within the US. The other one is the last step, which is a follow-up. What do we do now? So are they all sorted? How do we follow up? Who is our circle of support? Our circle of support as the practitioners. Where do I go with my questions? Where do I go to send my clients to? Where do I go for resources? So these are the ones that I'm hoping to achieve through this training as well. Especially because I am calling it HAT community for a reason. Because I believe anybody who goes through this systematic education, like myself and my colleagues in England, that we are still keeping in touch, we are still managing a listserv within ourselves, and we support each other through any difficulty professionally and sometimes personally. I really, really hope that HAT becomes that community for our isolated profession, psychosexual therapy. On this note, I hope that I answered some of your questions, at least the ones that I received I tried to cover. For any more information regarding the course or the whole training, please feel free to visit my website, and also on my Facebook page, professional Facebook page, I post regular question and answers regarding HAT. I truly hope that you consider this course if you feel that it's appropriate to meet your needs, and I look forward to welcoming you to our HAT community.